The RESTORE trial is an important study because it's the first study we've done with the TGF-beta superfamily ligand trap, similar to Luspatercept and Sotatercept, but different. So this study was the first study where we've used this agent, previously known as KER-050, now known as Elritercept, may be familiar to listeners because it also has been used in MDS. So in the study we used monotherapy and combination, and the data that's presented at ASH 25 is super exciting because not only does it solidify what we understand about the benefits of this drug, which we might expect to be anemia, but it actually extends beyond that. It includes anemia, spleen, symptoms, improvements in platelets. But what we saw at this meeting was some changes in the JAK2 VAF for some patients. So super exciting and a prelude to probably a phase 3 trial.